we're going to look at a Volar Slab, and a Volar Slab is used for when we've got patients coming in with metacarpal fractures. There is a gutter slab that we use for the 4th and 5th metacarpal as well, but we'll go on to that a bit later. This is a Volar Slab for the metacarpal. So plastic is put onto the palmar aspect of the hand and arm, and the hand needs to be nicely cupped in that natural kind of shape. I always say, imagine your kids coming up asking for pocket money, and that's the kind of shape you're looking at it for. So with the Volar Slab, again we have a booklet here that's got all the ingredients for this, and again these are guidances for average size adults. So for Max I've got my bandage, my plaster, 15cm plaster and a 10cm padding there, ready to go. And I've also got my water ready, which is lukewarm water, because obviously the plaster does react with the water and heats up by about 10 degrees, so I don't want to burn Max and give her any other problems, only for the fracture there. So I'm going to actually start by putting the bandage in to pre-soak, so that it doesn't shrink when I put it onto the plaster and cause Mag any further problems. I'm going to start by putting the padding on as well, and I'm just going to have a measure, because we do have the plaster backs here as well to actually go ahead and use up instead of using all the rolls up. So the landmarks for the Volar Slab are the crease in your knuckles there, so it's your metacarpal heads, going down to 2 fingers below your antecubital fossa. Being an old-fashioned girl, I'm in inches, so I'm going to have a look at that. I'm still going to measure for about 12 inches, just over a little bit, because sometimes it shrinks. Unfortunately, you can't stretch it if it does that. There's different types of shaping here, as you can see, very much similar to the below elbow back slab. There is another way of shaping, we're just cutting a chunk out of the top there. We'll follow what the book actually says here. So we'll put a stirrup in, take a chunk out of the thumb, just trim the nasty sharp edges off, because when it's nice and dry the plaster will become that much sharper. Going around the edges off it here too. So lovely, we should be about ready to go with that. So just pop it over here for a second. So the padding then, I'm going to start off from the top. So just above the antecubital fossa, so we've got a nice turn back. I'm going to go around a couple of times so it gets a nice bit of soft padding, but then it's important that we do go down the 50-50, so there's sufficient padding on the patient's arm but not too much that it's going to get squashed and the plaster then becomes loose. I'm going to stand at Mag's edge, arm here. So we'll put a little rip in the top here so we can make space for Mag's thumb. Come round again. And then just come off and tidy up the loose ends. One nice thing about padding this way, we've got a nice bit of padding over the patient's seam remnants there, which is important so that the plaster doesn't rub. Soak the plaster in the water. Put it out slightly, but I like a bit of fluid in there. I don't want it to be too dry, otherwise I'm not going to be able to mould my plaster to Max's arm very well. It's laid across. The important thing I'm going to look about at the moment is making sure it's going across the metacarpal heads there and round, and smooth it off nice and smoothly and mould it to Max's arms. There's a debate, you might actually say that a 20 could be better for Max because it's just going around her elbow. But these are things, your judgments that you have to make when you actually do the plaster. But of course there's nothing to say, if you think your plaster size is incorrect, take it off and start again. I'm just going to trim it because, true to form, I've allowed for it, but it hasn't happened, it hasn't shrunk. So there's no harm in trimming off the plaster to make sure that it fits the patient nice. Lovely. So now I'm going to bring my turn back. And I'm going to anchor the plaster to Max's arms. Again, start off around the wrist just to anchor it. And come up. Twist. Capturing all the fold back so the patient doesn't fiddle with it. and off back up the arm we go. Okay. So I'm going to tie off, just put a little knot in the nut bandage so it doesn't tie off and nip off anymore. And then tie off on the actual plaster itself. Now whilst you need a good plaster and a good neat plaster, you can't hang around too much, simply from the point of view that one thing we need to do now is just make sure that it's nicely moulded into Mags's hand. So again, that hand is in that nice cup shape as if she's in that natural position to keep her bones nice. Just while the plaster hardens off and it's in a nice neutral position. So after doing that, we're going to tidy our patient up, because as you can tell. And then we just need to make sure that Mags can move her fingers. Lovely. And her thumb. And that the plaster isn't rubbing at all.
No.
And that Mags can actually bend her elbow without it actually giving her any problems.
That's fine.
Lovely. Okay then. Any pins and needles or anything like that?
No.
No? Good. And that feels normal naturally. It feels nice and warm too.
Yeah.
Okay. So again, Mags will need to come back to Fracture Clinic. Now these plasters are never completed, so I won't need to worry about giving her an appointment in a couple of days' time to come back in case it needs to be reassessed and completed, because that's not the case with Volar Slabs. So this will be on for the duration of Mags's healing. But we'll still need to give her the Fracture Clinic booklet with her addressograph label on it, and all the bits and pieces, important pieces of advice like it dries naturally, please don't put it in front of the fire or use hair dryers on it because it will just melt instead. Please don't soak it in the bath or in the shower because it will just come off and you'll need to come back and have it reapplied. If it's a bit itchy, I'm sorry, try and take your mind off it, but no knitting needles or rulers down there because you can cause yourself a bit of damage to your skin and it might get infected. We don't want that to happen either.
Okay.
Anything gets down there, money, beads, that's usually in kids, but even so, we have to think about that. It's not a money box or a toy box. You need to come back and get that reapplied in case it causes you any more problems. Any signs and symptoms like pins and needles, numbness, blueness in the fingers, pain, especially if you've had your pain relief but it hasn't worked, it's really terrible pain to touch, come straight back. We need to see you straight away. If Fracture Clinic's open, you're directed to Fracture Clinic. If not, come back to ED. Anything else I need to tell you? It's going to take about 48 hours to 72 hours to dry. So when you're in bed, have it elevated in the bed, but you're going to have damp bed blankets and sheets in the morning.
Okay.
And of course, we're going to pop it into a nice sling for Mags, so just because it's nice heavy plaster, and take regular pain relief is always a good thing to remember.